Okay, great. Thank you, Sylvia. And welcome everyone to today's webinar. As mentioned, we're going to be talking about mental health amongst agricultural workers and how they impact this vulnerable population. So for those who may not be familiar with the National Center for Farmworker Health, NCFH is a private nonprofit organization located in Buda, Texas, which is right outside of Austin, Texas. And our mission is to improve the health of farm worker families. We do this by providing a number of different programs, products, and services in support of our mission. We actually just celebrated our 45th anniversary last year. And so we're very proud to be able to serve the 174 migrant and community health centers in our network who provide primary care services to agricultural worker families. So as we begin today's webinar, I want to reference the learning objectives. We're going to be discussing the importance of mental health outreach and integrated services for migratory and seasonal agricultural workers. My hope is that you'll gain an understanding of strategies that we discussed during the Mental Health Learning Collaborative, and that we will also be sharing mental health resources that you can utilize with this vulnerable population. So before we dive into our content, I'm going to have you answer a few polls. So Sylvia, if you don't mind, if you can launch the first one. Here we go. And it actually lists all the questions that I'll have you answer. So if you can just fill out each one, there's a total of 3. One asks if you're familiar with the ratio of the number of adults in the United States who experience mental health conditions. You can answer one of those options there. And then it also asks you to answer true or false for a couple of statements. So one related to stressful working conditions and how it's associated with depression. And the other is a statement about agricultural workers and what they reported as diagnosis in our 2019 data that was collected at that time. So we'll give you a few moments to answer those now. And then Sylvia, let me know when those responses are ready. Okay, so you should be able to see your results on your screen. It seems like about 40% think 1 in 3 is the ratio, about over 50 say 1 in 5, and most or 100% say the second statement about stressful working conditions is true. And most agree that the third statement is true in terms of 89%. So thank you for that, Sylvia. So to truly address the polls that we just took, I want to talk a little bit about mental health in America as it is today. So for those who answered 1 in 5 for the ratio about adults experiencing a mental health condition in a given year, that was correct. Statistics, according to the National Alliance on Mental Illness, or NAMI, indicate that 1 in 5 is the actual ratio of individuals that experience mental health conditions. And that totals about 46.6 million people a year. So even in today's webinar, if we do 1 in 5, it could be actually a couple of us, since we're about 10. So maybe 2 out of the 10 of us even here this afternoon may have experienced some sort of mental health condition in a given year. So now in terms of agricultural workers, the National Center for Farmworker Health actually updated our mental health fact sheet this year. And in doing so, we did discover that there was a strong correlation between stressful working conditions and depression. So I believe everyone had answered 100% for that statement being true. So you were correct. There is a very strong connection between depression and how stressful how much stress you experience within work or the work that you do on a day-to-day basis. Now, in conducting research and gathering information for our fact sheet, we also discovered that there were several factors amongst agricultural workers that contribute to poor mental health. And studies show that they do tend to report depression as one of the higher mental health conditions to health centers when receiving services, unfortunately. Some of the contributing factors to that statement were really related to the type of work that they do. So that was a driving factor. And some other factors were hardship in terms of finances and also poverty. So those were some contributing factors that were found amongst agricultural workers. So now that we've talked a little bit about them, let's talk about the current state of the United States overall in terms of mental health. So even before COVID-19 hit, mental health was already a significant factor amongst our population. The prevalence of it really affects a large majority of Americans in the United States. But the latest data set from 2017 to 2018 showed an actual increase of 1.5 million people in that year. And so you can imagine from that information, right, that was the latest a couple of years ago to now, 2021, in light of COVID, that number is expected to be even higher. Some other alarming statistics that were gathered from this report in particular, which is the report from the Mental Health America, they actually showed that suicidal ideation is also increasing in the United States, and that mental health amongst youth in particular is worsening. In the data that the report analyzed, a total of 9.7% of youth in the United States indicated having a severe major depression. And those actually indicated that individuals who were of more than one race or who identified as multiracial adolescents and children were at a higher rate of risk. So that was definitely something alarming, and it showed that there's just a continued need for mental health treatment amongst young children and adults. And we're going to be sharing some links to some of these reports and statistics. You'll see that Sylvia is adding those in the chat. So if you want to read more in depth about some of these numbers, I would encourage you to go to the report and just look for some of this information that really does show how important it is to raise awareness about mental health overall, especially for vulnerable populations. And now, in light of COVID in particular. So before we really get into the element of mental health, I think it's important to set some context for agricultural workers. So let's begin by talking about actual agricultural work. So agriculture has consistently been ranked one of the 3 most dangerous occupations in the nation, and that's following transportation and construction. In 2018, it actually, there was a reported 411 cases of agricultural workers who lost their life while doing agricultural work. So this is in large part due to a number of things, and we're actually going to talk a little bit about some of those occupational and environmental risk factors that contribute to this number, but that also contribute to mental health as a medical condition amongst this population. So some of the occupational risks related to agricultural work are probably some that you've already heard or are familiar with if you serve this vulnerable population. You may know that agricultural workers do a lot of repetitive motions and heavy lifting. And so in doing work, whether it's harvesting or picking, carrying, packing, whatever it is they're doing for the crop, at that time, it's a lot of motion that's done over and over and over again. And so this contributes to their risk of injury, especially if they're handling any type of machinery or tools. So you'll see here, if they're handling equipment of any kind, that could be a risk factor. Also, just the nature of the work. If workers are being paid by a piece rate wage, for example, agricultural workers might be needing to work harder, longer, and faster. So in not taking breaks and not taking their time, that can contribute to the risk of potential injury, especially if they're trying to get things done quickly so they can gather some more pieces to gain more money as they work. And now in light of COVID, something that we've also seen is just a lack of safety precautions in the workplace. Now, you'll see here in a moment that this has already existed, but now with COVID, it's definitely been intensified as agricultural workers may or may not have access to personal protective equipment, may or may not be able to practice social distancing. So it's really hard for them to truly follow the guidelines that CDC currently recommends in order to mitigate the risk for COVID-19. I wanted to touch on some of the environmental factors that also play a role for this population. So aside from just doing the day-to-day work with the nature of labor itself, agricultural workers, really come in direct contact with the land, with the plants, with the crop that they're cultivating or harvesting. So having this direct contact with plants does put them at risk for exposure to pesticides and chemical fertilizers. There's also certain plants like tobacco and strawberries that naturally release chemicals that are toxic to humans and that can actually cause severe allergic reactions or even conditions like dermatitis. So these are different types of risk factors that agricultural workers may not necessarily have control of if they're dealing with a particular type of plant or crop. And as mentioned, they may or may not have the ability to be able to wash their hands properly or have access to a hygiene station or a hand washing station. So if they're exposed to chemicals or pesticides, it's really hard for them to be able to, practice proper hygiene and sanitation if they don't have those adequate resources available to them. Okay, so now to talk a little bit about the actual health outcomes related to the occupation of agricultural work. You'll see here that these are some of the more common injuries that agricultural workers experience as a result of the nature of the work that they do. And as mentioned, it's very much tied to the repetitive motion that they do in harvesting or whatever the task is for the crop. So there's a large number of musculoskeletal injuries and disorders that this population experiences. There's also injuries from machinery and equipment. I lightly touched on respiratory infections. I mentioned, their exposure to potential pesticides or chemicals. And so that can also lead to certain respiratory infections and problems. Being out in the environment can be a factor for heat stress. So that's also sometimes something that they experience. And not only that, just being outside makes them vulnerable to be able to be bitten, by insects, rodents, or snakes. So they might experience some of these things as they're working because they're outside, because they're in the fields gathering the crops and food. So this is a big risk for this population as well. And obviously we're talking about poor mental health today, and we're going to really dive into it here in a minute. But a big factor that I wanted to touch on as well is that a large portion of agricultural workers are immigrants, so they are truly vulnerable to labor trafficking. Agriculture is actually the second highest, has the second highest number of reported labor trafficking cases in the United States. So this is something that is very real for this population. So now to touch on some of the environmental outcomes, you'll see here common illnesses and ailments that this population experiences as a result of the environment that they may live or work in. So intestinal diseases and parasites are very common, urinary tract infections, skin conditions, lead poisoning, respiratory conditions, and then now, just an increased risk for infectious diseases, especially if housing is shared. So being at an added risk for COVID or the flu or TB. There was a study in North Carolina that actually found that most camps where agricultural workers lived had overcrowding. There was an average of 6.4 people per household amongst indigenous agricultural workers, and then there was an average of 4.6 people per household for Latino agricultural workers. So this is a very common thing that we see where agricultural workers actually live together, share housing. Oftentimes it's within a family unit or extended family. And if it's not family, it's very close friends or individuals that they work with. So they tend to share housing if they're not able to afford housing or if it's not provided by an employer. So this population definitely is at risk for just living or working in substandard housing, considering that they may or may not have that provided by their employer. So all of these risk factors definitely lead to poor health outcomes, but research indicates that agricultural workers have actually lower rates of chronic disease compared to the general population. But we believe that this is due to a lack of access to health care. So if agricultural workers struggle to access health care, obtain treatment and services, there is an underdiagnosis for this population. So it's not that they don't necessarily experience these chronic conditions at a lesser rate or lower rate than the general population, but we just don't know because they're not reporting it. And again, because they don't have access to providers and treatment and aren't engaged in the healthcare system. So if they're not going in for services, there's no way to truly document whether or not they're experiencing any of these chronic conditions. And for agricultural workers, especially agricultural workers who are migratory, meaning that they travel often from one location to another for work, it's very difficult for them to receive a proper chronic care because they're constantly moving. Being that they're mobile, it's very hard for them to receive continuous care and to even practice proper self-management for some of these conditions that you see listed here. So I'm curious if any of the audience has, personal experiences about what they see at their respective health centers. If you can share in the chat, is there any particular chronic conditions that you see amongst your population, or is there any that really is highly reported when you work with agricultural workers? That would be great for you to share. We're obviously here now to talk about our mental health conditions. So if there's any specific mental health conditions that you identify amongst your agricultural workers, I would love to hear about that too. What you see here in the current slide are some of the more common mental health conditions that we see amongst this population, and these conditions are truly associated with high levels of stress. So you'll notice that anxiety, depression, substance misuse are pretty common mental health conditions amongst agricultural workers. And in large part, this could be due to a number of factors. So as I mentioned earlier, migratory workers that travel for work, they may or may not be traveling with their family. So being isolated and alone is a big factor to some of these conditions. They also might be separated from their family. If that's the case, then that can lead to symptoms of depression or even substance misuse we found amongst this population, just because there's the lack of family support or a feeling of disconnectedness and being so isolated. A couple of the things that we've often seen is there's just also I'm seeing some of the comments here. People are very distrusting of medical centers and fear of ICE. Yes, grief over COVID. Yes, and those are contributing factors to fear of when their immigration status is a factor. There is a fear of deportation. So a large number of agricultural workers may not necessarily want to seek services or treatment because they don't understand the system, know how to navigate, or even understand whether or not they're at risk of being deported if they go to seek services. Acculturation is something that we often see with this population as well. Many agricultural workers come from different countries. A large portion of them do come from Mexico, but there's some that even come from Central America or in South America. So there's, a large number of there's a lot of diversity amongst agricultural workers. And we've even seen agricultural workers from Haiti. So there's some, different cultures that come through to the United States to work. So feeling like they have to assimilate to the Western culture in the United States, or not connecting to the culture, can lead to a large number, or just high levels of stress, because again, they aren't familiar with the country. They don't know how to navigate it. And we're going to talk a little bit about some of those social determinants of health that really do contribute to poor mental health outcomes here in a minute. But we have seen some intimate partner violence as well within this population. So that's a big factor. But agricultural workers may be reluctant to talk about mental health overall. And this is in large part due to cultural barriers and just stigma of mental health in general. So if an individual were to be experiencing symptoms of any of these conditions that you see here, they may or may not feel comfortable seeking support or in talking to a healthcare provider about it, just because of the stigma of mental health and some of the social determinants of health that we're going to talk about here in a minute. Post-traumatic stress disorder is a significant condition. As I mentioned, a large number of agricultural workers may be immigrants. And so along their journey and traveling to this new country, they may experience trauma along the way. And it may be traumatic to arrive to a new country. And so like I mentioned, there's that connection with acculturation there too. And so it is very common for them to experience some type of traumatic stress as a result of their journey. So as I mentioned, stigma really is one of the biggest barriers for mental health treatment in general. not just for this vulnerable population, but for anyone seeking support for mental health. Stigma is the perception or when someone is being viewed in a negative way because they have a mental health condition. So it's oftentimes a feeling of shame or judgment from someone else. Stigma can also come from an internal place, and individuals who experience mental health conditions might have a feeling of being bad or feeling bad because they have a mental health condition. And navigating life with a mental health condition is hard and enough in and of itself. So if people have added stigma, they can experience isolation, feelings of self-blame, and really fear and embarrassment. So this makes it a huge challenge for them to reach out and to gather support. So for those 1 in 5 individuals that experience mental health conditions that we heard about as we began today's presentation, for them, living with a mental health condition and experiencing stigma can be very alienating. They might feel like they're, going to be judged in a way. They might be afraid of rejection by family, friends, and they're often very misunderstood because of the symptoms that they experience. So for agricultural workers in particular, those from the Hispanic or Latino communities, talking about mental health is a big challenge. The stigma that they experience is culturally based and really related to the beliefs that they have from their culture. So there is a lot of embarrassment. There's a lot of fear. A lot of agricultural workers, like I mentioned, do not necessarily talk about mental health or even understand mental health as part of primary care. And so they really do need help understanding that this could be something that you could receive treatment for. I believe someone had mentioned, that they, in the chat, I was just reading, that they may have physical complaints. And so, yes, mental health symptoms can present themselves in different ways for different people. And so if a agricultural worker or any patient doesn't understand that connection, and they just see a physical symptom and don't know that it's connected to their mental health, they might have a very hard time even identifying that as a mental health symptom and are less likely to seek support for it. So there's a lot that really does contribute to this feeling of being stigmatized, and stigma does deter patients from accessing healthcare. Now, some of the other challenges, in particular for this vulnerable population, are social determinants of health, or SDOH factors that we see here. This vulnerable population truly does experience a lot of barriers to accessing healthcare in general, and even much more for accessing mental health services. So you'll see here some of the ones that you might even already be familiar with if you work with this population. So, they travel, so they're very mobile. They might have issues with transportation, finances. Language is a big barrier. Limited literacy levels or just limited access to technology. And what we're actually finding now is limited digital literacy levels, which is something, in light of COVID and telehealth that is now we're having to kind of deal with and make it adapt our service delivery for this population. But as mentioned, there's different beliefs that they may have, or just a lack of understanding of the system. And so this really does put them at an increased risk and can lead them to be disconnected from others. Some systemic level social determinants of health you'll see here, because as mentioned, with the nature of agricultural work, some workers may or may not have policies that include sick time, may or may not have insurance. And so it's very hard when you have these systems challenges for them to access care and just take off work so that they can receive treatment. Preventative care is not necessarily a big priority for this population, not because they don't care about their health, but because they just don't have the ability to leave work, because that could mean deciding, from their basic needs and receiving care. And if they have a family to support, children to feed, it's a very difficult choice to make. And oftentimes agricultural workers will continue to work despite feeling any type of symptom. So as mentioned, in light of COVID, these are some of the things that we've seen now, especially in the field of mental health, that there has just been an increase in illnesses related to mood, like depression, anxiety, grief, an increase in rates of substance use, and an increase in chronic stress at work, especially for essential workers, which agricultural workers were classified. And not just for agricultural workers, but I also wanted to note that this has been the case for healthcare workers. So for you that are attending here today, there has been significant impact of mental health in you experiencing chronic stress at work. There's a huge need to address the current pandemic, to get the vaccine implemented at your service sites, I'm sure. So some of these conditions might even be symptoms that you might be experiencing at work. So it's important to note that that is something to be aware of, especially if you notice within yourself some symptoms you're experiencing as a result of what you're doing on a day-to-day basis. So considering all these things that we've talked about now and how important it is for this population to receive care, NCFH actually launched a learning collaborative this past year to look at how we can increase potential mental health outreach to agricultural workers, and also increase resources for health centers on integrated behavioral health care. So a large number of our network has either some community provider that offers mental health services, so they're referring, or they're considering integrated services at their sites, or have an integrated care clinic already. So when we launched this learning collaborative at NCFH, we really tried to recruit health centers that were either entertaining the idea of an integrated program or needing to integrate a program within their primary care services. So you'll see here the list of health centers that we recruited this past year. So we actually were very fortunate enough in finding a number of health centers that had this interest, and even actually had a community-based organization that partnered with the health center locally. So they were the referral source. And we had a primary care association also that wanted to really gather information to be able to share with their network. And so amongst the members that participated in our learning collaborative, we had clinical supervisors, coordinators, a large number of community health workers that were conducting outreach to this vulnerable population. And we also actually had some behavioral health providers themselves that were part of integrated programs or that were wanting to create integrated programs at their service site. So we were fortunate enough to be able to recruit so many great participants this past year. We also had some guest speakers that participated in our learning collaborative, and you'll see the ones that joined us here. Salud Family Health Centers spoke. We also had someone from the Vecinos Farmworker Health Program. And our partners at Florida State University have a great program. So Dr. Reyes and Dr. Rosado joined us for a couple of learning sessions and really talked about the success of their integrated program. So this is a quick overview of the learning sessions that we did in the Learning Collaborative. We talked about COVID and how it's impacted mental health amongst agricultural workers. We also addressed primary mental health issues that impact this population. And then we gave an orientation to some mental health screening tools. So we were able to gather some really valuable resources in terms of mental health screening assessments and tools that were shared by our speakers. And I'll be showing you some today that we've compiled in the hub. So I'm hopeful that you will be able to use and incorporate some of these into your service delivery as well. We had a session at our virtual regional stream forum in March, and then we really followed up with that session for action planning and implementation. So when participants kind of wrapped up, we looked at, okay, what now? What can you do with what you learned? What is it that you're going to be doing? And how can you implement the information that was gathered at your service sites? Because these health centers were at different kind of phases of the integrated program. So within the Learning Collaborative, we looked at the collaborative care model, which is a framework that really involves the service delivery of behavioral health services by a collaborative team. And most often it includes our primary care provider, some sort of physician or nurse practitioner, and then some case management professionals that are part of that team, like a nurse or a clinical social worker, and then the consulting behavioral health provider, whether it be a psychiatrist or whoever it is that's providing the actual diagnosis and clinical treatment. So we looked at this model in terms of providing information for our members. So if this is something that you're interested in implementing at your site, this could be a great model that has 5 evidence-based principles that really can be effective for integrated programs within a primary care clinic. So as I mentioned, these are the principles that we really looked at within the model. And it's very patient-centered. So it focuses on how do we treat the patient while working together as a team, and how do we provide adequate care to this vulnerable population so that it's effective and that it's something that they can use no matter where they are. And so when looking at this population, really determining the type of agricultural worker that you serve is going to be critical in how you implement this model at your service site, because you could potentially have agricultural workers that are very mobile, that are migratory and travel often. So your time frame for interventions might be small or very limited. Or you might have agricultural workers that are seasonal. So they might be around a little bit longer, but maybe their schedules are very demanding. So when we talk about integrated care, these are some of the options that you could look at. You could have a referral source. So if you're a primary care clinic, you can coordinate care to refer out. You might have a provider that's located in the same location with you, but their services are still a little separate. Or you might have a fully integrated team, which is what FSU has. And the team truly does work together and share their EHR, their health system and everything. So it's fully integrated by the team. So we also looked at some clinical pathways and algorithms. So these are perspectives, things that could actually guide the model as you implement it. Here are some examples of it. And we talked about how you could potentially adapt these based on your patient population. So now let's jump into the actual resource hub. So I should be able here, and let me know if this doesn't show up, but this is our resource hub, which I really am excited to share with you. The resource hub will be launching this Thursday as we announce it in our digest, but it is a culmination of the tools that we gathered in the Learning Collaborative and some patient education materials that NCFH has been able to develop as a result of what we learned in the Learning Collaborative. So I'm hopeful that each of you will be able to explore our website once it launches in a couple of days, and because there's a lot of great resources. And like I mentioned here, some patient education materials that you can actually use when conducting outreach for mental health. So here's a resource that I really want to share because it's particular for healthcare workers. So it provides information about the population. It provides information about maybe some concerns that you might see if you're addressing mental health with agricultural workers. And it also gives some tips for how you can really start this conversation. Be that bridge for having that patient connect with you and your providers so that they can access services. So this is just one of the tools that we developed. We also have this tips for reducing stress tool. So this is great for actual patients. So if you're talking to them and want to provide a quick, brief intervention to just how can I deal with this stress? The stress, like we said, looks differently in every person, but it offers some things that they could do and even has some really great pictures and a space where you can even add. So if you're working with the patient, these are some things that you can modify or print out or even add here for things they specifically identify that help them to de-stress. So some really great resources here and some more that are actually coming soon. So not only that, we have resources that you could incorporate in just working with the Latino Hispanic community here. And then, like I mentioned, we gathered screening tools. So for individuals that are wanting to implement the integrated programs at your service site, we have a vast list of screening tools that you can use for adults and children and adolescents. And then we also included some safety assessments because, as I mentioned, domestic violence or intimate partner violence is a very concerning issue amongst this population. So these resources here are particular for that in terms of just ensuring safety within your patient. The thing I like about these tools is that they are that they can be used with anyone, including agricultural workers. So any patient that you have that comes into your health center, you can incorporate and be able to use the screening tools with them from your integrated behavioral health team. So your providers can really use them to assess for the need of the patient. We also have some national mental health resources here. As I mentioned, NAMI is one of them, but we have others that you can access and really gather additional information on. We have the direct links here, and then we have some COVID-specific mental health resources that we've gathered. Our actual NCFH COVID page is listed here. So this hub has, again, a wealth of information for you. And we're excited to be able to offer this as a resource for you and your health centers. A couple cultural considerations that I just want to touch on before we start to wrap up and really talk about some resources within NCFH are these here. In working with this population, trust is an essential component to connect with them. Just to address stigma in general and to encourage them to be able to access care. establishing rapport, having those general interactions, and for you as community or health providers, being open to community settings that are outside your typical brick and mortar site, because as mentioned, a large number of agricultural workers do work outdoors. So being flexible and actually having those opportunities to serve them, whether it be within the community or where they work. We know several health center staff that conduct outreach at actual farms and fields, or that do screenings and testings out there, but they have an established relationship with those growers. So being able to have that is important. Practicing cultural humility, being aware of the different practices, beliefs, and behaviors of this population. And again, knowing that that symptoms, mental health symptoms, can manifest differently in every person. We also encourage providers to practice universal precautions when discussing health services overall, because there is a limited level of health literacy and education amongst this population. So if you have those precautions already in place when you communicate and you develop patient education materials, you're more likely to be able to reach this population successfully. And the reason why we're here today, obviously, is to address the stigma and reluctance of discussing mental health. So normalizing the connection between physical and mental health and stressors that really do impact this population. And you saw several of the ones that we've already talked about today. And as I mentioned, being mindful and aware of these social determinants of health that truly impact this population and that become big challenges for them to just access care in general. So just to provide an overview of what NCFH does, aside from this awesome hub that we have coming up, we offer a number of different services that you see here that we can provide assistance for. So I would encourage you to look at our website and contact us for any information if you're needing assistance with any of these types of resources. We also have our learning collaboratives that will be continuing next grant year. So we're actually going to start recruiting over the summer. So we encourage you to participate if you have any interest in joining our learning collaboratives. We also have some specific patient resources. As I mentioned, COVID-19 is one. We have an amazing diabetes resource hub because we know that this is a big priority for HRSA because diabetes impacts the Latino Hispanic community at great rates. So we have a specific hub and actually two learning collaboratives that are related and focus on diabetes efforts. So I would encourage you to look up those as well. And NCFH is a big partner of the Ag Worker Access Campaign. So we helped launch this in 2015 with our partners, the National Association of Community Health Centers, or NAC. So if you're not familiar with this campaign, we encourage you to look us up and to join our efforts because a big part of addressing mental health for this population is just being an advocate for them and raising awareness about this population in general. And so that's what our campaign does. And so if you have a minute, we do encourage you to please look up our campaign and join us in this initiative. NCFH has a few webinars coming up. So I would encourage you to check out our webinar page. We have one on diabetes later this week. And then we have one from our amazing partners at FSU, Dr. Elena Reyes and Dr. Javier Rosado on May 25th. They were also our speakers for our mental health learning collaborative. They're going to be talking about toxic stress on May 25th. So if you have a minute and want to sign up, we encourage you to do so for these webinars. We also have our Ag Worker 102 with the Farmworker Health Network, which NCFH is a part of. So I would encourage you to sign up for that webinar that's coming up in June. Here are a couple of newsletters. If you want to stay informed about our services, about any new products, webinars, connect with NCFH, sign up for our monthly newsletter that will give you the latest information on what's coming out. We also encourage you to connect with us on any social media platform. These are all of our handles and where you can find us. So feel free to just connect with us there as well, because we often announce different items and even our digests on social media too. But other than that, that concludes my presentation, and I'll go ahead and address any questions that may have come through. Sylvia, I'm not sure if we had any.